Dolly Parton has been a celebrity for a long time, since her 20s. I do believe she's had a rhinoplasty done, because before you used to notice that hump there, and now there's a smooth transition here. And also, she's well known for her breasts. Breast augmentation has been around since 1960. It was not uncommon for celebrities at that time to enhance themselves. She's always had high arching eyebrows, but they look a little bit higher. Her upper lids look like a little bit softer, like some volume has been removed. She always has her hair in front of her ears, I think more so in her later years, to hide any facelift scars. A facelift scar usually is a scar in the sideburn area, comes in front of the ear behind this thing that sticks out called a tragus, and then comes around the earlobe and then behind the head. So she never really exposes that area again, and so I believe she's had a secondary rhinoplasty done. I think also she had her breast augmentations done with larger implants. Usually the normal aging part of the breast is you don't have that shelf-like look. So the only thing that could be is an implant, and they do look larger than they were years before. I think around this time she may have had a small cheek implant, or she may have had some fat grafting in her face. This was a little bit before fillers, so I believe possibly she had one of those two procedures performed. This was around the time Botox started, so she may have gotten some Botox treatment. At that time, they were also injecting collagen. Her lips in this picture do look a little bigger, so she probably had some collagen injection to her lips. You can see now she's developing a little more crepiness around the eyes a little bit. She has some crepiness like around her mouth area and below her cheeks right here in this photo here. And then the next year, everything looks tighter. So she's probably getting some skincare tightening devices at this time. And I do believe she may have had another little tuck to her upper lids. Her brows look a little higher. Brows usually don't stay that high as we get older. Usually they go lower as we age. 2020, her breasts look a little bit smaller to me. I think she had a third, possibly breast augmentation at the time to put smaller implants in, but her chest looks a little smaller, which is very common for someone who has large implants to do later in life, because it can add to the weight of the back and the neck and could put some kind of strain on the body as we get older. This is age 76. Once again, the eyelids can get a little creepy over time. I do think she's had another tweak there. If we kind of look the year before, you can see some crepiness and wrinkling in this picture where it's pretty much gone. So I think it's possible she's had another little tweak to her eyes there. I think she has had a lot of tweaks along the way. Her neck looks consistently tight. Most necks, look a little lax as time goes on. So I think her plastic surgeon has done a great job. I think it's done very tastefully and very nicely. She has invested a lot in her looks, and I think it's paid off for her very nicely. She's maintained wonderful youthful looks.